My name is Amber. This is my third child, Ezra. He's nearly 3. He is my second child with complex medical needs.
Elio has a very rare genetic condition called Costello syndrome. He's one of 300 in the whole world with that condition. Yeah, so in a normal week, Elio will see 2 different physios, an OT, perhaps a GP, a paediatrician. He has
speech
pathologist, a dietitian. He has an endocrinologist, a cardiologist, a neurologist.
Our healthcare system is one of the best in the world, but it's becoming increasingly complex, and it's really difficult for families and their children to navigate the healthcare system effectively without some support from us. And that's what complex care navigation is.
Having a paediatric care coordination program and a paediatric care coordinator is ideal for the ability to deliver services to parents and families in rural and regional areas.
The care coordination service supports me by just being that spokesperson for me. If I'm ever needing to liaise with a specialist for appointments, then Sarah will jump in and be that person for me.
Yeah, the care coordinator has helped us so much in firstly finding local specialists. That means we don't have to travel to Queensland. Coordinating more than one appointment at Queensland Children's Hospital when we do need to go.
Finding missing records, missing pathology things, just all of the things that go awry in big hospitals that we don't know how to navigate.
The demand's been extremely high for this service since I started in this role. I did not realise that there were so many families in our community with children with very complex care needs, requiring care coordination.
Not being linked in with the service obviously meant that I didn't have that person that would support me through that and advocate for both Ezra and I to be seen and treated in the best way possible.
The issue for children with complex medical needs is sometimes rural and regional hospitals do not meet the full services that they require from a medical perspective, and we need to look at services in tertiary or quaternary hospitals to be able to provide that level of care.
Elio had to get a G-tube surgery, and that required just so many different departments at different hospitals, and coordinating all of that, there was hours on the phone which we got nowhere until Sarah came in and kind of brought all of that together. It took more than 6 months to get happening, and without her it would have taken a year more.
The ability for this service to meet the needs of families goes far beyond just convenience. A lot of families with kids with chronic and complex healthcare needs suffer with significant mental health issues on a burden of care for their child.
It's also very important for me, as obviously a very big part of the picture in Ezra's care, that my emotional health and mental health is checked in on, and that is something that Sarah has consistently done throughout the process.
Care navigation is vital to developing relationships both locally and interstate with our clinicians and specialists, and it builds trust over time to allow the patients to navigate their entire healthcare journey.